In this video, I'm going to go over the supplemental syllabus for fall 2024. I want you to all do well in this class, so I think it's really important that you know the expectations before the class starts so you know what's expected of you, okay? So this class is a medical surgical nursing class, but it also has some mental health components in it because you have 24 hours of mental health clinicals in this course, and you are also going to take the mental health proctor. And I know you haven't taken proctors before, but this semester in this course, the Med-Surg 1, you will take the fundamentals proctor, which is an exam about fundamentals, okay, made from ATI. Instructors don't know what's on the proctor, but we are going to try to get you in the best position to do well on the proctor. And then the mental health proctor as well at the end of the semester. So you'll have some mental health lectures in this class and some activities about mental health, but also med-surg, okay? One of the jobs of an instructor is to foster a professional identity in nursing in all students, right? You came here to be a nurse, so we have to teach you how to be empathetic. We want you to have integrity, to tell the truth, not to engage in academic dishonesty, and to engage in lifelong learning, okay? So that's our job. We want to model the professional behavior that we want you to follow. We don't expect you to be perfect, and please don't expect us to be perfect. We all try to do our best, right? Student support services. This is what I feel like is underutilized at Bryan and Stratton. We have a virtual library, which is available to you 24/7. And you can find the link in your student portal. But also, we have tutoring available at the Learning Center. There's math tutoring available. There's English tutoring available for when you have to write your case study, which I'll explain later. They also have math tutors for your dosage assessment. If you're struggling with that, you can bring your computer and show them the modules in ATI or the type of questions you're having trouble with. Okay, so, and we also have something called BrainFuse, and you can find it in ePortfolio and Tools contact area of Blackboard. And they have nursing tutors that are available to you. So please remember these services and utilize them. These are our course outcomes. So we will be meeting these course outcomes during the course of this class. We honor diversity, sensitivity, and inclusion at Bryan and Stratton, okay? And we're going to agree, everybody in this class, to be civil to each other, right? I know emotions start running high when you get stressed because I know you have a high course load and you're working really hard. So let's try to mitigate that by you reaching out to your instructor or program director or myself for when you need some direction or some help, okay? We all want you to be successful. That's why we work here, because we want to prepare entry-level nurses. That's our goal, okay? So we want to help you, but you have to tell us if you need help. Okay, these are the institutional outcomes. Be doing tutoring once a week for skills assistance if you need any help with that. Here are the required texts. So you have to have a laptop. You have to be able to download Google Chrome. The reason is that you do your testing in ATI. In ATI's Google Chrome is supported by ATI test. Make sure you clear your cookies before you take an exam. You need a microphone and you need a camera, a webcam. And this is because when you take your dosage assessment and when you get to next semester, you'll be doing some exams on Proctorio, which is not a tutoring service, a proctoring service that they'll be watching you while you're taking your exams at home. All right. The book is Stromberg. It's Medical Surgical Nursing Concepts and Practice, the 5th edition. Okay. You don't need to buy the study guide if you don't want to. I don't know if you already have Calculate with Confidence, but you really, everything you need is going to be in ATI. There are wonderful modules in ATI on dosage assessment if you're struggling with that. And each one of those modules has about 25 practice questions. So there's unlimited practice questions for you. So if you don't have it, I wouldn't buy that book now. But if you have it, it's also good for problems as well. All right. Um, then I want to talk about if ADA accommodations. So if you had accommodations last semester, you have to get them redone every semester, and it's not the same process. So please reach out to Mr. Adams about what you need to do each semester, and then each semester you would give that form to your instructor. You don't have to give that form to your instructor if you don't want to use your accommodations. That's your right, but I would encourage you to use them. We have an e-portfolio at Bryan and Stratton. It's electronic, and that is for, there are some artifacts, which means assignments, that you are going to be uploading to the e-portfolio. And this is to prove that you're meeting the end of program student learning outcomes. Okay. So for this course, your authentic assessment or e-portfolio artifact is a case study about a respiratory problem somebody has. And we'll get into that. That's going to be due week 11. Okay. The rubrics in the course content, and we'll go over that in a different video. Okay. Now the time commitment necessary to earn course credit. It's going to be individualized because you all come from different backgrounds. So if somebody has a background, or sometimes students have been to other nursing programs, they may have a little bit more knowledge. Okay. So maybe it's not going to take as much time for studying for them. Okay. But a good guide is you want to study 3 hours for every hour you're in class. So this class is a 2-hour class. So you're going to study at least 6 hours a week for this course. Okay. And then for your clinical in this course, you have 6 hours of simulation. Simulation is used in lieu of clinical hours. So be on time, do all the things you would do in clinical in your simulation. There'll be 24 hours of direct patient care and mental health, and 60 hours of direct patient care and medical surgical nursing. So that's a total of 90 clinical hours that are required for this course. So make sure you're uploading your paperwork after, what's required of you by your clinical instructor. You want to be checking your grades frequently in your clinical course to make sure you're getting a P and not an NP for no passing, or an F if you haven't uploaded anything. Okay. Just keep up with it, because sometimes students don't upload their paperwork and then they don't pass the clinical portion of the course. And if you don't pass the clinical portion of the course, then you don't pass the course. Okay. So really just keep up with uploading what's required of you. That's all we ask. All right. Attendance and participation. Please come to class. Please be present. Please engage in the activities we design for the class. It takes a great deal of time to make activities for classrooms. So if the instructor has made an activity for you, that means they put considerable time into that activity, and that what you should do is, engage in that activity. But also when you're studying, you need to refer back to that activity, because oftentimes that activity is going to be designed to meet the most important outcomes, I should say. Okay. To meet outcomes and, the kind of items you're going to be tested on in your exam. So make sure you're going back, especially if they do something with like rationales in it. Make sure you're going back to read those rationales, incorporate what you learned into your notes. That would be beneficial. Okay. And make sure you're reading your notes daily, just skimming them daily. Not a huge study session, but the other thing you might consider doing is joining a study group. And in the study group, you have about 6 people. One person needs to be the leader. The leader assigns content to each member of the study group. And when you meet as a study group, you are to teach the other people in the study group about that content. That is the highest form of learning. And I would encourage you to start this now, because Med-Surg is very vast, and you are not going to be able to memorize everything in med-surg, okay? You have to learn how to break things down and think to the next higher level about, like, what kind of questions do I think they're going to ask me about on this content? And we'll talk more about that in class. All right. If you've missed 14 consecutive days at Bryan and Stratton, you need to contact your academic advisor. Um, Please make sure you try to resolve your concerns with your instructor before contacting a meeting. We now have program directors, so Miss Greenbaum is the program director of the practical nursing program. You would meet with your instructor, and if your problem isn't resolved, you would meet with Miss Greenbaum, and if it's not resolved still, then you meet with the dean, okay? Clinical paperwork. There are some paperwork that needs to be uploaded before 1700, the evening before the first scheduled clinical rotation. If it's not uploaded, you will be sent home, okay, and you won't be able to participate. Now, if you miss a clinical day, you have to make it up. The problem is there aren't a lot of makeup days. So you may end up taking an incomplete. And if you take an incomplete, you will not be able to progress in the program. So you're going to have to take a semester off to complete those clinical hours. So please, unless you're really sick, make sure you are in clinical every time you are scheduled for clinical, right? Be on time, do the work, and get it done, okay? Your clinical grade, you have to upload your daily clinical evaluations, your 2 head-to-toe assessments, your midterm, your finals, and the global daily clinical form. Clinical paperwork is due 24 hours after the last clinical day, and failure to meet this is going to result in clinical course failure. So please make sure you're uploading everything as you go through the semester. Instructors love that, okay? If you're going to be sick, please email 60 minutes before the clinical start time. You're going to email the nursing instructor, copy the program director, the dean of nursing, and the clinical coordinator on all emails. You need to provide documentation to me within 72 hours. Now, if you have like a flat tire, car trouble, your child sick, you're still going to, take them to the doctor and give me documentation if you have a flat tire. I need a picture with you in the picture in your flat tire, dated and timed, please. Thank you. And if you're sick, you have to provide documentation from a provider within 72 hours, okay? Simulation, we talked about that a little bit earlier, but there's very little makeup slots for that. So please do not miss your simulation day. If you do, you probably will have to wait until next semester to make up, and you will not be able to progress. Okay, you'll have to take a semester off to do that. Medication administration and clinical, you're going to need to do 2 successful medication passes during the clinical rotation, and the first one can be an orientation, so you know what's expected, okay? Head-to-toe assessments, you're going to have to pass 2 head-to-toe assessments, and your clinical instructors will inform you. There's going to be a couple more assessment points that we build on from your fundamentals head-to-toe. So every semester you'll be given more assessment topics, okay? Communication with instructors. Communication should be through the email, and communications have 24 hours to return your email. Or if your instructor said, like, look, I don't check my emails till 2 o'clock every day, can you please just wait before you, send me an email saying your instructor didn't get back to you, okay? And if it's the weekends or if your instructor is in clinical, you should expect an email back within 48 hours. Please don't contact clinical sites. You're not allowed to record audio video without the instructor's permission in any setting. We expect you to have academic integrity during exams, when you're writing papers, okay? It's expected. Professionalism, you can read through that. Here is your grading we're going to talk about. This is important. So we don't round up. So remember, you need to have a 70% exam grade, exam average grade, and a 70% overall grade to be successful in the course. You'll have 3 exams, which are 75 questions each, and a final, which is cumulative of 125 questions. You have 2 proctored assessments. They're 5% of the total exam percentage. Okay, so if you earn a level 3, it's 100%. Level 2 is 80%. Level 1 is 60%. ATI determines the levels. Okay, so you want to get a level 2 or higher. That's the best. If you get a level 1, you're going to be, actually all levels do remediation, but for level 1, initially you'll get a 0, and when you complete the remediation, then you will get your 60%, okay? Quizzes are going to be 10% of the grade. Authentic assessment, which is a case study, is going to be 5% of your final grade. And homework is going to be 10% of your final grade. All right, ATI, fundamentals and mental health. Practice A and practice B with a focus review is 5% of your final grade. All right, your exams are weighted. So you'll use a weighted calculator to figure out your exam grade, but we will help you with that, okay? So exams 1, 2, and 3 are weighted at 19% of the exam average. The final exam has a higher weight, so you need to do well on it, at 33%. It is cumulative. And the proctor's assessments are 10% of the exam average, so 5% each equals 10%, right? All right. And then you got to complete practice A and practice B and do a robust focus review. So when I'm grading practice A and practice B, I don't really care what you got on it. I want an honest assessment. So don't look up in your book. You need to know where your personal deficits are to do well in ATI, okay? So you, after you do it, you're going to go into the focus review, and you'll see the topic on the side, okay? So know what you're looking for when you go into the book where they take you, or into the resource. And then write down at least 3 bullet points for each item you missed, each topic to review, okay? Because you are making yourself a personalized study guide by doing that, to study for your proctor. And you should be studying that daily, like reading through it daily to see where your deficits are. And then retake it when it's open again. So after everybody has uploaded their focus review, the instructor can put the rationales on and also open it up so you can go back and take it. And you should wait a week before retakes, okay? And see if you're doing better by studying your notes. All right. Dosage assessment. Hopefully you've all done this already. The passing standard is 90%. You need to, if you're struggling, go to the Learn tab in ATI, Dosage Assessment and Safe Administration, and do the modules in ATI. Do all the practice questions. It is such an awesome tutorial. You will do well on the assessment if you do those tutorials. Okay. So grading policy, all right. You have to turn in assignments before class. They're due before class. If you turn it in after class, you'll receive a 0. Actually, instructors make it disappear. The drop down disappear. So if you miss it, like if you have, of course, if you have something going on in your life, please reach out to the instructor. We want to support you through any difficulties, and we can offer some grace. But the majority of the time, you're going to be expected to upload the assignment right before class when it's due, okay? And also classwork will be assigned during class, because you get points for that too. When you come to an exam, please be on time. Please make sure your laptop is charged. You cannot have any electronic devices on your body. So your cell phones are going to be put in a designated place with your keys, your badge. The only electronic device you can have is a laptop. And please, 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 please don't forget if you have a cell phone in your pocket, because if you're found with an electronic device during an exam, you will receive a 0 on the exam, okay? You can go use the restroom if you need to, not a problem. Just put your test on pause. Only one student can go at a time. Okay, so you need to ask the instructor before you go. All right, you're going to get a sheet of plain paper and a pencil before each exam. Please write your name on the paper. We need to get the paper back. But also, if you're struggling with dosage assessment, I really need to know, and I need to look at your sheet of paper to see where you're struggling. So please write out, if you do struggle with that, please write your problems out so I can determine, or your instructor can determine what the problem is, okay? All right, makeup exams, you need to you need to email the instructor before the exam if you're going to miss it, or you will get a 0 for the exam. Now, I want you all to be successful, so please do this if you're going to be sick, okay? Even if, just let me know what's going on. Sometimes, your child care falls through. I understand things like that. Just let me know, okay? Before the exam. Exam remediation is required after each exam in Proctor. Okay, so what remediation entails is you're going to download your report from the exam or the proctor. In all those topics to review, you're going to write 3 bullet points for each topic to review. Okay, and if you don't see the report or you don't see the topics to review, reach out to your instructor and they can turn them on. Okay, because you don't want to get a 0 for the assignment. After exams, usually the next week in Med-Surg 1, because it's such a short time span in that class, you will do a collaborative exam, okay? If you are absent that day or you come in tardy, you are not going to be able to participate, and you will take a 0 on the collab portion of the exam, okay? I just want to say that up front. An exam analysis is done after every exam. And if you have any questions about the exam, you need to contact the instructor within 2 weeks. Okay, there's no changes and there's no going back 2 weeks after an exam. Final exam is cumulative. I talked about that. The exam rigor is going to increase over the course of the semester. Okay, and students kind of have trouble with that, with how to apply information. So again, that's why we do a lot of activities in class so you can understand how to apply nursing knowledge. And then the select all applies are 10% of your exam. And each exams 1, 2, and 3 have 5 dosage questions, and the final will have 10 dosage assessment questions. So remember, I always tell students math is free points. So if you're having trouble, please go see the tutors, reach out to your instructor, do the tutorials I suggested, please, please. Okay, that does it for your supplemental syllabus for the fall 24 semester.